Hello and welcome everyone to this week's OzSAGE briefing. My name's Richard Holden, one of the members of OzSAGE. I'll begin by asking Kalinda Griffiths to give the acknowledgement of country.
Thanks, Richard. Before we begin today, I would like to acknowledge the traditional custodians of the many lands on which we're meeting. We recognise that sovereignty was never ceded in this nation and our ancestors still walk with us today. I'm coming to you from Larrakia country in Darwin and pay my respects to all elders, those of the past, the present and the future. My name is Dr. Kalinda Griffiths and I'm an epidemiologist at the Centre for Big Data Research in Health at the University of New South Wales. I'm a Yawuru woman, my family name is Corpus and my country is in Burrundi, Western Australia. I'm going to give the overview of the Aboriginal and Torres Strait Islander statistics. So as the COVID pandemic continues in Australia, we need to make sure that no one is left behind. To do this, it is a recommendation of the Aboriginal and Torres Strait Islander OzSAGE working group that 95 to 100% of Aboriginal and Torres Strait Islander people over the age of 12 years need to be fully vaccinated before states and territories open up. This has not been achieved in New South Wales to date, and therefore the relaxation of restrictions now poses real risks for Aboriginal and Torres Strait Islander people. Aboriginal health leaders from other states and territories are advocating for high rates of vaccinations, with John Patterson from the Aboriginal Medical Service Northern Territory recommending 95% vaccination rates, and the National Community Controlled Health Organisation CEO Pat Turner recommending 100% of Aboriginal and Torres Strait Islander people to be vaccinated. This is to ensure our survivorship, to ensure that we are not left behind. There have been 4,200 Aboriginal and Torres Strait Islander COVID-19 cases. In the latest outbreaks, there have been over 100 cases in the ACT in Victoria and more than 3,800 cases in New South Wales. Aboriginal and Torres Strait Islander people have experienced an incidence rate that is almost twice that of non-Indigenous people throughout the Delta outbreak. So 430 versus 250 per 100,000 people. I think it goes without saying that there is an urgency to get Aboriginal and Torres Strait Islander people vaccinated. We also have a younger age distribution with higher rates of underlying conditions that can impact disease severity caused by COVID. As of the 8th of October, there have been 450 Aboriginal and Torres Strait Islander cases hospitalised, with around 50 people that have been admitted into ICU. 9 people have died, all in New South Wales. Early analyses also suggest that the proportion of deaths in younger people aged 40 to 59 years is about 3 times higher than that of the non-Indigenous population. So COVID is a disease of the unvaccinated. So if it gets into regions and communities with lower vaccination rates, it will spread very fast. We've witnessed some of the impact that can occur and know that there will be devastating consequences if this disease continues to spread, particularly through regional and remote Australia. With already stretched healthcare services and limited workforce availability to manage COVID patients in those regions, it is anticipated that things can and will get much worse if not managed properly. We have the capability as a nation to work together to ensure the safety and security of all of our citizens. But there's still much work that needs to be done to better support the vaccination of Aboriginal and Torres Strait Islander people in Australia. Currently, 53% of Aboriginal and Torres Strait Islander people over the age of 12 years have received at least 1 dose. 36% are fully vaccinated. Importantly, the ACT has passed 80% of Aboriginal and Torres Strait Islander people receiving at least 1 dose, and New South Wales and Victoria have both passed 70% of at least 1 dose. So more good news is, thanks to the extensive efforts of Aboriginal and Torres Strait Islander community controlled organisations and the efforts from both the Commonwealth and state governments, the pace of the vaccine rollout for Aboriginal and Torres Strait Islander people in the ACT, New South Wales and Victoria has been moving very quickly. The pace of vaccine uptake in other jurisdictions is still much lower, with some Aboriginal communities in remote Australia being reported as low as 5% fully vaccinated. The fact is that Aboriginal and Torres Strait Islander people continue to be vaccinated at a rate that's almost 20% lower than that of the general population. With the lower vaccination rates and greater impact from COVID, it is therefore very important that attention, resources, and innovative approaches are directed towards supporting Aboriginal and Torres Strait Islander people and communities, particularly to those services already doing the hard yards. And this is a time for governments to be listening to medical experts, Aboriginal medical services, communities, and those people working on the ground to ensure that Aboriginal and Torres Strait Islander people have the things that they need to protect themselves and each other. In order to assess the needs of different communities and different regions, there is a requirement for information on service accessibility and impact. Despite the recommendations and ongoing call for accurate and appropriate data, there is still a clear need to improve the transparency, the quality, as well as the availability of disaggregated data. That is data that's broken down and displayed by population group and regions. These data are important because they let us know who needs what where. There are still many people in the general population who are not vaccinated, and an even higher proportion of Aboriginal and Torres Strait Islander people unvaccinated, driving the urgency of this issue. We recommend that a publication on Aboriginal and Torres Strait Islander vaccination rates is presented by state and territory local government areas, that there be a maximum effort by all service providers to increase vaccination levels to at least 95%. And we also encourage all Aboriginal and Torres Strait Islander people to get vaccinated, making sure that any concerns are discussed with those people who know what they're talking about. So Aboriginal community controlled health providers, as well as general health providers as well. So as New South Wales moves towards more relaxed restrictions and other jurisdictions work towards easing restrictions, everybody needs to know that there are people being left behind. There is a responsibility of governments and individuals to support and protect those priority populations that need additional assistance to ensure equity within this nation. We want to make sure that no one's left behind. Thank you.
Thank you so much, Kalinda, for that and underlining that important message in addition to those data, but underlining the important message about what we need to do to ensure that nobody is left behind. Just to remind everyone, my name's Richard Holden. I'm speaking from Bidjigal land today. And we today on this important day in the pandemic, particularly in the Greater Sydney area, we're releasing two advice documents, one on protecting children from COVID-19 and making schools safer, and the second one on creating safe workplaces during the pandemic. I'm going to begin by going through some of the aggregate data for the week very briefly, and then I'm going to introduce members of the working groups on those two advice papers to present those advice. And just a reminder to any press that we'll present those and then take questions from around 3:30 or a little before. So you'll see that, and this is accurate reporting up until just before the time of this briefing, that over the last week there have been over 14,011 reported community cases. Importantly, nearly 52% of those are in people below 30 years of age, and that in terms of vaccinations, now 61.9% of Australians over 16 are fully vaccinated. But again, I think Kalinda's data underlies the point that these are aggregate statistics, and we must pay careful attention to what each of the important subgroups of the population's level of protection is in moving forward. Next slide, please. We'll see that in terms of the doubling time of these rates, New South Wales has made good progress here. A higher number is good news, of course, taking longer for infections to double, cases to double. New South Wales making good progress. I think importantly, Victoria has not really improved, and it has the same rate of growth for the past month and a half, despite the measures that have been in place there. And I think it's also important to emphasise that these numbers, particularly for New South Wales, are backward looking. They're at the current levels of health orders and restrictions that have been in place. And as those are relaxed and as those change, obviously these numbers are subject to change, as we've emphasised in previous statements and previous advice documents. Next slide, please. Unfortunately, 97 deaths have been reported this past week. 10 of those were linked to outbreaks in aged care settings. We know that 5 deaths occurred among people who were in their homes in New South Wales. Victoria is not reporting details beyond aggregates of age and gender and the local government area. But 1 death we know Australia-wide occurred in a person in their 20s, and 11.7% of deaths were among people who were fully vaccinated. So we still see there 292 people in ICU, 169 of those ventilated at the time of this briefing. And that's a reminder of already the strain that the hospital system is under, and that's under the existing measures that have been in place so far. So we'll continue to keep you updated and report on those numbers as they evolve over time. As I mentioned, we have 2 advice documents today. The first is on what to do in the workplace, and shortly I'll introduce 2 of the leaders of that working group. The advice for both of these documents will be available on our website from the time of this briefing, so I'll refer you to that for full details. I wanted to remind people of one other important point, which is at a time when there is change in restrictions and public health orders, it's very important to remember that these things have changed over time. There are many people, quite rightly, providing reminders to us on media and social media and through other avenues about what is required in the workplace, what employers are required to do under public health orders, and what individuals' obligations are in terms of everything from wearing masks to their travel and in terms of showing vaccination in various venues. Rather than give you an imperfect summary of those, I'll just remind people that if they are in any doubt, that government websites do have those things, those public health orders available in all of their up-to-date form and up-to-date detail. In particular for people in New South Wales, the New South Wales government website has the very latest orders at a time when those things are changing, and it's important to understand what our obligations to our fellow members of the community and to those in our workplaces are. I will now move to the working groups. We'll start with the Creating Safe Workplaces working group, which I had the good fortune to be a small part of. And I'll begin by introducing Stephen Duckett, who is going to give us an overview of the advice that we have there. And then Kate Cole will go through quite a deal of the substance. So Stephen, I'll pass over to you now.
Thanks very much, Richard. And I just acknowledge that I'm sitting on the unceded lands of the Wurundjeri people of the Eastern Kulin Nations, and pay my respect to elders past, present and emerging. And this is in Melbourne, for those who don't know the Aboriginal lands, First Nations lands. The COVID Safe Workplace Group was initiated in response to requests of OzSAGE for advice on what should be done. Now, in New South Wales, Victoria and the ACT, and in fact in some of the other states as well, employers, businesses, organisations are subject to public health orders. Those public health orders are in a sense minimum standards. They are what the law requires as a minimum you have to do to protect your workplace and the employees and customers. Businesses are now used to the idea of producing COVID safe plans for their workplace, and all organisations have those in place. But these are the public health orders are minimum standards, and as Richard pointed out, you've got to be sure that you're obeying the public health order as it is actually promulgated, not what social media, for example, might say the public health order is. So what we were asked, what people approached us for, was to say, well, what is good practice? What should we be doing as organisations, as businesses, as employers? And if you're a member of a board of directors, you're very well aware that you've got obligations for a safe workplace, and employers have obligations for safe workplaces from the state and national workplace health and safety laws. So we've tried to distill this, and we've used a very standard approach used in many workplace health and safety approaches called the hierarchy of controls. And we identified four levels of control. The first being vaccinations, obviously. and also working from home. The second being the very important issue of safe air, ventilation, because the virus is aerosol spread. Thirdly, administrative measures like testing and workplace bubbles. And finally, masks. So that's the general overall picture and why we did it. And it's over to Kate, who is full-time job is occupational workplace health and safety. So thank you, Kate.
Thank you, Stephen. And hopefully my slides have come up, just sharing my screen. So I'd like to just acknowledge that I'm coming to you today from Gadigal land in Sydney, Australia, and pay my respects to elders past, present and future. So COVID-19 is not only a public health issue, it presents a significant workplace health and safety risk, and one that employers around Australia have been grappling with for over a year. As an occupational hygienist, yes, my work is to prevent illness and disease in the workplace, but in this context, we've really leveraged the experience, or the diverse and crucial experience across OzSAGE, and that's enabled us to create guidance to support business to open up safely, to mitigate the risk of infection in the workplace, and to improve their likelihood of indeed staying open for a long time, because that's what we want. Key to recognising this, or doing this, looking at this entire approach, is recognising that SARS-CoV-2 is airborne. Understanding how the virus spreads is crucial when knowing what to do and how to control it in a workplace. Overseas experience with the Delta variant shows us that vaccines alone are not enough to control COVID, and that a layered plan, including safe indoor air, masks, testing, tracing, and work planning is needed to ensure business continuity and to avoid a cycle of start and stop lockdowns. The hierarchy of control approach replicated here recognises that there's a need for many layers of control measures. Those layers help keep workers and visitors to workplaces safe, and it recognises that some control measures offer a higher level of protection and reliability and some less so. However, each control measure remains integral to preventing disease outbreak. We know that workplaces with high rates of vaccinated employees will have a lower risk of outbreaks of COVID-19, and that improves business continuity for employers. We also know that facilitating working from home arrangements reduces the number of people in the workplace at any one time, and therefore that reduces the risk of transmission. These are really good workplace controls. We also know that safe indoor air and good ventilation is a crucial part of mitigating the risk of an airborne virus. And that's why within our guidance, we've provided a simple process that can be followed to help businesses understand how to achieve safer indoor air. Whilst we do recommend that businesses seek professional assistance in this area, we also recognise that not all businesses have the ability to seek ready access to these professionals. But there are steps that they can take to improve air quality, which is why we've replicated it in a really simple and easy to use graphic. The approach that we've included in our advice relates to the use of carbon dioxide or CO2 monitors as a surrogate for infection risk. It's a very straightforward model that, when applied, can reduce the risk of infection in the workplace. We've also included a lot of information on rapid antigen testing, and we've outlined the advantages and the disadvantages of using this technology as a screening tool to complement other control measures. We have seen this technology successfully used in many workplaces recently, and that's helped mitigate the risk of asymptomatic persons accessing the work environment, which is crucial. There are a significant amount of administrative controls shown in green here that can go a long way to mitigate the risk of infection in the workplace. Employers have a really big role to play here in supporting these controls. And we also recognise the importance of looking after employees' wellbeing during this time, because you can't have good employee health and wellbeing if you have an unsafe workplace. Personal protective equipment is always at the bottom of the hierarchy of control in a workplace health and safety context, but that does not mean that it's not important. In the context of COVID, they are an integral, crucial part of reducing transmission and to offer protection if there's any other breakdown of other controls. They're a complementary control. Safe workplaces are essential, and even though we've just opened up in New South Wales, we need to recognise that the risk of COVID transmission in the workplace still exists. Relaxing requirements under public health orders doesn't override an employer's duty of care under workplace health and safety legislation, nor do public health orders cover all potential ways to effectively and efficiently protect employees and customers and clients. And by providing this guidance at OzSAGE, we aim to support employers to truly create safe and productive workplaces. Thank you.
Thank you very much, Kate and Stephen, for that excellent overview of the workplace advice document. I think, you know, what Kate said there towards the end is important to underline and to emphasise that public health orders provide guidance about what minimum standards are, as Stephen said, what must be done. But part of what an important part of what OzSAGE's independent advice is about, it's about providing practical guidance as to how people can take relatively simple, effective and low-cost measures to try and make their environment, in this case workplaces, as safe as possible. It's important to remember that although progress is being made on vaccination, both overall vaccination rates are still not at levels where they will likely end up and where everyone would like to see them, and that in any case, additional measures, particularly in areas where important subgroups of the population are not as highly vaccinated, additional measures, vaccines plus, as we've emphasised, are incredibly important and effective in helping control the pandemic. The second document that we're releasing today is about the very important issue of protecting children from COVID-19, and in particular focusing on making schools and childcare safer. And Greg Kelly is going to speak to that document.
Hi, good afternoon, and thanks very much for joining us, everyone. As Richard said, my name is Greg Kelly. I'm a paediatric ICU specialist, paediatrician and OzSAGE member, and I'm dialing in from Bidgeville and Gadigal country in Sydney and talking about the OzSAGE work and document protecting children from COVID-19 and making schools and childcare safer. I'm really going to cover three issues. One, can we protect children from COVID? Two, should we? And three, if so, how? And so to the first question of can we protect children from COVID-19 and make schools and childcare safer, OzSAGE recognises the benefit of face-to-face learning for children, their families and the community. But this is often presented as a trade-off that in order to get those benefits, we must accept much higher rates of COVID transmission in this age group and that many kids will just get it. But in fact, that's not the case. It's clear that face-to-face learning can happen whilst simultaneously protecting children and the community from COVID-19. And I'd like to use the example of the UK on one hand and San Francisco on the other to demonstrate this. So when the UK returned to face-to-face learning earlier this year, they had no vaccination in place for 12 to 15-year-olds. They had no masking and they had no attention to indoor air. And by every measure, the UK return to school has been disastrous. So last week, an astonishing 1 in every 20 high school students in the UK tested positive for COVID in a single week. And however, the following week's data was even worse, 1 in 15. So an extraordinary 1 in 15 high school kids are getting COVID every week in the UK. Between 1 in 10 and 1 in 20 are off school at any time for COVID-related reasons, and their overall absenteeism in the high school group is 15%. So almost 1 in 6 students absent at any time. There's a high but as yet unknown burden of long COVID. Suffice to say that the NHS has opened 15 child-specific long COVID clinics. And of course, the UK COVID situation for the whole community is also a disaster with 1,000 deaths per week and over 800 people on ventilators. It's helpful to contrast that to San Francisco, also returned to face-to-face learning some months ago, but had some important differences. Very high vaccination rates in the 12 to 15 age group, attention to safe indoor air and the other hierarchy of controls that Kate mentioned, and universal masking for teachers and students. And San Francisco, by contrast to the UK, has had just 7 in-school transmissions since April. So it's clear that it's not about whether schools are open or not, but whether they are open safely and what measures we've taken to do that. And it is actually worth noting that the UK is now moving quite late to checking the indoor air quality and installing CO2 monitors in their school because they're recognising that their approach is clearly not working for the students, for their education, or for the community as a whole. So in answer to the first question, can we protect children? The answer is a definite yes. The second question is, should we protect children? There is an apparent controversy about children and COVID at the moment, where on the one hand, we have experts saying that COVID is generally a mild illness in children. They usually have relatively mild symptoms and recover quickly. And on the other hand, we have scenes in the US and Canada of overwhelmed pediatric hospitals and ICUs. And there appears to be an apparent controversy between these two positions. Actually, there isn't a controversy. COVID is generally a mild illness in children, and they are less at risk than adults. But there is no doubt that children can get COVID, can transmit it, can get sick from it, including long COVID, and can even die. And because children are the largest single unvaccinated group and all get together in small, poorly ventilated places, which we call classrooms, as Australia moves towards opening up, we expect the cases in those younger age groups to go up. And saw the data that Richard presented earlier that now a full 42% of cases are in the under 30 age group. So that younger, more mobile and less vaccinated, or not at all vaccinated, less than 12 age group, we're going to see an increasing number of cases. So while people are correct in that they say that only a small number of children get seriously unwell, even a small number of the very large number of children that we expect to get exposed becomes very important. The second point is that our child health system is much smaller than our adult health system because children rarely get sick from anything, COVID or anything else. And so while 1/4 of our Australian population is 19 or less, only 6% of our national ICU beds are allocated for that age group, which just shows the relatively lower likelihood of children getting sick from anything. And this goes further to explain how a small absolute number of sick children can easily overwhelm our small child health system. Long COVID in children remains uncertain and controversial, as you would expect for a chronic illness from a virus that's only been around for 2 years. But it is clear that children can get long-term symptoms, can meet the criteria for long COVID. I mentioned the large number of clinics that the NHS has set up for children. And remembering that children have many decades of life ahead of them, so even a mild impairment over a long lifetime becomes enormously important for that person and for the community. And so to the answer of should we protect children, again, the answer is yes. The third question is how can we protect children? And Kate actually went into this with a lot of detail. And unsurprisingly, because children are of course human, like people in workplaces, the things that we do to protect children in schools are very similar to the things that we can do to protect people in workplaces. And again, it's worth noting that the places that people gather are schools, homes, and workplaces. And we know that COVID is an airborne disease and really in some ways is a disease of buildings. And so we need to pay attention to the places where people, especially people from different groups, get together. And so OzSAGE has practical, cost-effective advice on protecting children and making schools and childcare safer, which is based on the most up-to-date science, has been proven in many places around the world, and much of which can be implemented in the very near future or even today. And it really comes down to the 3 V's, which are vaccinations, vaccines plus, which includes masks and other measures I'll go into a bit more detail on, and ventilation or safe indoor air. The concept of a hierarchy of controls or layers of mitigations that Kate mentioned is very important. The number of layers depends on the level of community transmission. Our OzSAGE document goes into how to assess the level of risk in the community and how different responses will be appropriate for different levels of virus. Masks are a critically important measure. We just last week heard the Victorian announcement about bringing in masks for grade 3 and above. OzSAGE strongly recommends masks for all school-age children and recommends where developmentally appropriate for younger children than that. We've seen examples from around the world, including New York and San Francisco, which I mentioned earlier, as well as Asian countries like Hong Kong and Singapore, which have masks for even young children and have shown them to be very effective at reducing transmission. Masks are really you get double effect from a mask because it both prevents the person with COVID from breathing it out, as well as prevents an uninfected person from breathing it in. So it's really a 2 for the price of 1 with masks. Attention to safe indoor air, testing the quality of indoor air and improving it either through natural or mechanical means, and where not possible, filtering the air. Vaccination of everyone that's eligible, which as we know at the moment includes all adults, teachers and children down to 12, hopefully in the next few months, we'll see a vaccine for the younger age groups as well. And important attention to scheduling, teaching classes outdoors, having staggered classes where possible. A key part of the OzSAGE recommendation, two key parts are: one, allowing parents to decide when it's safe for their child to go back to school. Every family's risk assessment will be different. We advise that governments shouldn't mandate children to go back to school, but should allow parents to decide when it's safe for their family to go back to school. And finally, the importance of protecting kids' mental health through this great uncertainty that comes with the pandemic, not just around disruption to schooling. Thank you.
Thanks, Greg, for that very helpful overview of the school's advice. That I think is really important advice and underlines the fact that, again, not only should we do things about to make schools safer for our children and our teachers, but that we can do them in really practical, relatively low cost ways. And it's important to do that. And I think the other thing that comes out from what Greg said is that if we want to see what can be done, we only need to look overseas. And if we want to see what can happen if we don't do those things and don't take appropriate measures, we also unfortunately have all too many examples from overseas, as we've seen throughout the pandemic, to look at to see what the counterfactual is. We don't need to learn all the lessons ourselves again, and we certainly don't want to make the mistakes that other jurisdictions have made. I'm happy to take any questions at this time, either through the chat or directly. And while we're waiting for that, I'll just ask briefly if there are any other comments from members of OzSAGE that they'd like to make, if there's anything that we've omitted. Let me ask that now. So in that case, I think what I'll remind people of is that these documents are on our website. One of the advantages of recording these press conferences and making sure that these briefings are done on a regular basis is that we are all accessible. All the members of the group are contactable and accessible. We'd be very happy to answer any detailed questions that people might have on any of these topics. The documents are on our website, and if anyone is watching a recorded version of this and wants to be in touch, I'd encourage them to reach out to us, and we'll be very happy to assist. And let me just reiterate what I said briefly at the start, which is public health orders are subject to change. This is a day where they are indeed in flux as anticipated, but different than what we anticipated only a short time ago in the Greater Sydney area and indeed in broader New South Wales. And it's important to check those out and stay current with those and supplement any other information that one might be getting through media or social media to ensure what one's obligations are. We do have one question that has come through for Kalinda, so I might throw that to you now, if that's all right, Kalinda. The question is this: what work needs to be done immediately to bring vaccination rates up in Aboriginal and Torres Strait Islander communities? What can we do right now to get those numbers up?
Who sent that through? Sorry, I missed the name there, Richard.
I'm not entirely sure who the question's from, but regardless, I think it's maybe one that was on many of our lips. Yeah, so thanks for that.
I think one of the immediate things that can occur is that people work on the ground. So what we've seen is that Australian medical teams and making sure working with community controlled organisations, going door to door, actually works. And so for those regions that are experiencing outbreaks at this point in time, making sure that we have those resources, those services that are known to work on the ground, doing that would be, I think, quite useful at this point in time. For those places that aren't impacted, so outside of ACT, New South Wales and Victoria, while it might seem like there's time to wait here, I don't think that there is either. So yes, we do need immediate resources on the ground, and this is people power as well. So perhaps maybe also pulling those resources from elsewhere. So we've also spoken about utilising, and pulling staff from existing medical services, but there are challenges with moving people across jurisdictions as well, and making sure that we've got university students as well. So utilising those people who may not ordinarily be utilised, but that can be useful. So things like nursing students, we can use them on the ground, handing out vaccinations after they've been trained, that sort of thing. So again, innovative approaches and using those resources that we already have, and redirecting services, I think, is the starting point. And we know this has worked. We've seen it out in Western Sydney, Western New South Wales, sorry, and yeah, that's the starting point.
Thanks, Kalinda. That's very helpful and underlines what we need to do. Since these documents are on our website, and I know many in the press will have read the embargoed documents, and so we'll already have those. And because this is being recorded, we will wrap up a little earlier today. Remind everyone that our website will keep these documents up to date. We still have working groups continuing to work on important aspects of this. We're planning to release new information this coming week, and we will keep those updated and keep everyone informed. So at this point, I'll simply say thank you very much for joining us. Please stay safe, stay well informed, and we will see you at our next briefing. Thank you very much.